On this edition of Veterans Health Watch, we'll learn how the VA Maryland healthcare system is using simulation learning to help keep VA clinicians sharp and our patients safe. We'll also learn how the VA Maryland healthcare system is growing to meet the unique needs of women veterans. Please join us. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The VA Maryland healthcare system is dedicated to maintaining patient safety and employing state-of-the-art technology. And joining us here today at the Baltimore VA Medical Center Simulation Learning Center is Dr. Abinur Habib, an anesthesiologist, to discuss and demonstrate the use of a high-fidelity mannequin that helps VA clinicians maintain and sharpen their procedure skills. Dr. Habib, thank you so much for joining us today.
Thank you for having me.
So let's start with a discussion about the Simulation Learning Center and how it's implemented throughout the VA Maryland healthcare system.
Simulation is an integrated part of the healthcare delivery system today. For instance, simulation is one of the steps required for the maintenance of board certification anesthesia. In 2009, the VA issued an executive decision to approve an establishment of a national simulation training and learning program called SimLearn. Then in 2012, there was a directive that was issued to address the urgent, emergent airway management outside the operating room. Therefore, the VA received a high-fidelity mannequin and a video laryngoscope to address this directive, which we implemented in this facility.
And that's great to hear that the VA was thinking ahead. And what is the purpose of simulation learning?
First of all, let me say this. We use the term learners, not students. Our program targets healthcare professionals that are currently employed at the VA. It gives them the ability to retain and sharpen their skills and maintain a high standard of patient safety.
And I know you're going to give us a demonstration, a little scenario on how you use the high-fidelity mannequin that you call Henry. But before we get into that scenario, can you describe how Henry is used to help and provide learning opportunities for VA clinicians?
Sure. There are three components. There is the mannequin itself, there is the master computer that allows me to manipulate the scenario, there is the learner's screen, monitoring screen. So I can make Henry talk, I can make him breathe, I can stop his heart and restart it again, I can listen to his breath sounds, to his heart sounds, I can check his pulse, I can actually connect a real-life defibrillator and shock Henry. Having said that, you need to remember that simulation is a technique, not a technology. We use technology to create scenarios, but at the end of the day, it is the learners themselves that create the simulation of the simulator per se. So depending on the type of learners, there are different type of learners that respond differently to different simulations. So we can create a wide variety of scenarios. We can, for instance, create a very simple scenario on how we communicate among ourselves within healthcare workers. We can create a scenario about a new piece of equipment that's been introduced to the VA. We can create a scenario on how many people it takes to take care of a patient in a given situation.
Okay, so our viewers can't see, but I can hear Henry breathing behind me. So I'm looking forward to getting into the scenario. So let's get into that now.
Well, the scenario that we're gonna practice today, we're gonna show today, is a classic scenario, and we called it 1 second count. And this can highlight certain abilities that Henry does have.
Okay.
Oh, I can't breathe and my chest hurts. Help.
What's that, sir?
Oh, I can't breathe and my chest hurts. Help.
Activate the rapid response. Sir, I'm just going to put O2 on you and some monitors on you.
I've got wide.
Hi, I'm from Rapid Response. How can I help?
He said his chest hurts and he couldn't breathe.
Sir? Sir, can you hear me? He's not responding. I don't feel a pulse either. We're gonna have to call Code Blue. Code Blue. Karen, you start compressions. Can you handle the airway?
I'm from Cold Blue. What happened?
Oh, when we found this patient, he was not responding. He didn't have a pulse, so we're starting CPR.
Okay, let's assign the roles. You're from anesthesia, you take care of the airway. Continue compressions. Augie, can you connect the defibrillator?
Sir. Going behind you.
Okay.
And let's analyze the rhythm.
Push analyze.
Analyzing. Clear?
Now. Stand clear.
You didn't analyze right.
Analyzing now. Stand clear. Shock.
Get
advised.
compressions.
Stand clear. Push to shock.
Get clear. Shocking. Shock deliver.
Okay, Amanda, go ahead and get an advanced airway. Do we have an IV access?
I have the IO.
Go ahead and put in IO.
Okay.
3, 2, 1. Ventilate.
Okay, the breathing tube is in.
The IO is in.
And go ahead, give 1 amp of epinephrine.
3, 2, 1. Ventilate.
Epinephrine's in.
Good, let's analyze the rhythm.
Stop. Analyzing now.
Analyzing now. Stand clear. No shock advised.
Do we have a pulse?
CPR.
Do we have a pulse?
We have a pulse. Let me see the next blood pressure here.
Let's reassess. We got a pulse, we got a heart rate, we got a good blood pressure, we got an advanced airway, we got an IO, the patient is stable. Good job, everyone.
Dr. V, thank you, you and your staff for showing us the scenario using Henry. After you've completed such a task with VA clinicians, what types of assessment tools do you use to, I guess, grade their performance?
Remember, debriefing is key for any scenario. First, you have to create a very safe environment for the learners and make them feel comfortable. And then let the learners discuss the scenario itself. You can actually use video cameras to record it and let them view themselves acting. And then let them make comments about the simulation itself, how they perceive the simulation. Now remember, the goal here is to improve the delivery of care for our veterans.
Right, so it's good to know that the learning never stops.
Learning never stops.
Learning never stops. So where can people learn more about the VA Simulation Learning Centers and the program?
There is a website, and you can go to www.simlearn.va.gov and read the newsletter.
Thank you so much, Dr. V, for sharing this time with us. We really appreciate learning how the VA is always proactive in providing patient safety for our veterans.
Thank you.
We're going to take a short break, but when we return, we'll learn more about healthcare services offered to women veterans. So please stay tuned.
The service that we provide at the VA Maryland healthcare system is among the best in the state.
We are committed to quality, safe, and compassionate healthcare to the veterans we serve.
They do all that they can possible to make sure that the veteran is comfortable and have all their answers addressed, their needs met. I wouldn't choose to go anywhere else.
The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around central and eastern Maryland.
All these facilities provide a broad array of services.
The services that the VA Maryland healthcare system offers includes primary care, ambulatory medicine, oncology services, women's health services, surgical services, mental health services, pharmaceutical services.
The surgeries, the laboratories, the hematologic, the oncologic, the cancer therapies, all of these are expressions of our desire to make sure that every day our patients get the best care possible.
Our healthcare system changes year to year and through time. So we do see ourselves as a modern healthcare system that's constantly adapting.
We're seeing a much younger generation of veterans who are coming through the door today, and we're also seeing a larger percentage of women veterans who are coming in. And the VA Maryland healthcare system is leading the way to adapt to that change and to provide the types of services that our younger veterans are looking for, while still serving our veterans as they age.
Here we developed a women's clinic that worked in conjunction with the primary care clinic as well, and we cared for women veterans. And that program has just grown enormously.
The VA Maryland healthcare system uses technology and in many cases at the forefront, cutting edge, including electronic medical health records, one of the first systems in the country to use that. And we very much depend on that. We're virtually paperless.
One of the exciting new transitions that we have here in the VA Maryland healthcare system is our use of telehealth technology. And this allows our veterans to be at home but still check in with their medical team to provide data such as how their blood pressures are doing, how they're doing with mental health disorders.
We are certainly a leader in education because there are a large variety of programs that train with us.
Our students, residents, and fellows are training here side by side with us, taking care of our patients. And what that leads to is our veterans receiving really cutting-edge care.
The servicemen, the servicewomen who have served in our nation's armed forces are cared for in a respectful and in a state-of-the-art way.
The VA Maryland healthcare system distinguishes itself because we have a mission, and our mission is to take care of our veterans and their families. Our staff are really the linchpin, the key to that mission.
Many of our staff here are veterans themselves. Our staff come from all over the country, from all walks of life.
They are very involved with the patients, very compassionate about the struggles that patients may have health-wise or otherwise, and really work really hard to help them to overcome that.
They know how to laugh, they know how to cry, and they know how to advocate for their patients and their families. They do all that in an incredibly human and caring way.
Just to be able to come to work and to work with veterans, whether I know who they are or I've never met them before, gives me a great sense of honor, and I really feel like I'm giving something back to our country. And I would encourage all of our veterans and our family members and anyone who might be watching to let a veteran know that you've served and you do have benefits, and you should go to your local VA and inquire about your eligibility for health care services. Please don't sit out there and think that the VA can't serve you. You served, and we would like to serve you now.
Welcome back to Veterans Health Watch. Joining us to discuss the services and programs available to women veterans is Dr. Catherine Starpoli, the Chief of the Women's Clinic. Dr. Starpoli, thank you so much for joining us.
Thank you, Kenya.
So Dr. Starpoli, I know you've been with the VA for 20 years.
20 years.
Tell us what it was like for women veterans back then.
Well, when I first started here, we basically had just a women's clinic. And we've evolved, particularly in the last 10 or 15 years, to have a real interdisciplinary team now. We have a women's health team. We have a separate women's health clinic that we're in. It's beautiful. It's in a separate part of the hospital. And we have many interdisciplinary members as part of our team, which is something that we did not have 20 years ago.
And why is it so important to have a program specifically designed for women veterans?
Well, traditionally at the VA, women veterans have been a minority of the population. And in the last 10 years, we've seen a doubling of women veterans. We have over 4,000 women veterans here at VAMX. And 10% of the veteran population is women nationwide, as well as here. So it's very important to have a home for these women. Historically, having been a minority, there were not a huge number of programs specifically designed for them. And most of our women veterans are young. The average age of women veterans is 45. So we have a lot of women veterans that have reproductive needs. They have needs of young women, and we need to provide those services. So we have grown into having our own clinic and having an interdisciplinary team that's for primary care for women veterans.
And give us a little more detail about how is this program designed for women veterans?
Well, we offer many services here at the VA, preventative services including mammograms, pap smears, birth control, in addition to all the other preventative and primary care services that anyone would receive here at the VA. We do mental health screenings, and we offer pregnancy care as well. We don't do it here, but we can pay for that to be done outside. So we have a large variety of services that are geared specifically for women, in addition to primary care services that would be for any veteran.
And tell us more about that interdisciplinary approach. You mentioned the team and
Yeah.
how that team works and how it benefits the women.
So I think one of the biggest things that has evolved in the VA is the initiation of patient-aligned care teams. So instead of having just your doctor now, we have a group of people that are part of a team that take care of a veteran. We try to be very veteran-centric. So we have nurses, we have social workers that are part of the team, we have pharmacists that are part of our team, we have physicians that are part of the team, and we also have mental health people that are part of our team as well, and we work together to help to provide services for patients.
And what does that look like to the patient? So if a patient comes in and you have this team, how does that benefit the patient? How does the patient use that team?
Well, we have nurses that are available to answer phone calls. We have, if someone needs, let's say they need a mental health evaluation that day, we can get that done by our team member. If people have a pharmacy issue, our women's health pharmacist can come and help us right then and there, because we're all linked together as part of a team.
And how does that help to manage the care for that person?
Oh, I think it's great to manage care for patients because they have access to us. They're able to call us and be in touch with us. People can have appointments with our nurses for blood pressure checks. We can have appointments with our pharmacists for management of chronic diseases. So it improves the access for the patients. And because all of these people bring different strengths and knowledge to them, with them to our team, it's very beneficial for the patients to have all of those people working to improve their health.
Right. So they're not just relying on their doctor for everything.
They're not just relying on their doctor for everything. We have a whole team of people that are working together in conjunction with the doctors.
Right. Dr. Starpoli, there seems like there's so much for women veterans to take advantage of throughout the healthcare system. Where could a woman or a family member learn more about these services?
They can learn more on the internet at womenshealth.va.gov. That's a great national site that has lots of resources.
Great. Well, thank you so much, Dr. Starpoli, for your service to women veterans, and thank you for spending time with us today.
Thank you, Kenya. It's my pleasure.
Well, we're going to take a short break, but when we return, we'll have more information about VA healthcare services for women veterans, and we'll talk to a woman veteran, so please stay tuned.
I think one of the exciting campaigns that the VA Maryland healthcare system has embarked on is the Televet campaign. As a veteran myself, I'm really more interested in what a fellow veteran's perspective on their healthcare service is going to be. So I would really encourage all of our veterans who have been to a VA Maryland healthcare facility to tell fellow veterans about their experience.
I wish someone would have told me about the VA healthcare years ago. If you see a veteran, ask them if they're using VA healthcare.
Make a difference. Tell a vet.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
Welcome back to Veterans Health Watch. We're here at the Baltimore VA Medical Center Women's Veterans Clinic, and joining us is the program manager for the Women's Clinic, Ms. Zelda McCormick, and a U.S. Army veteran, Ms. Anita Nesmith. Thank you both for joining us.
Thank you for having me.
Zelda, it's great to have you on the show again. In the past, we've talked about how the women's program has changed, and I want to hear about this program that most people wouldn't associate with the VA when we think of pregnant women. So tell us more about that.
Okay. Well, with the increasing number of female veterans in their childbearing years, we have established and implemented maternity care coordination. So we're not delivering babies, but we do connect veterans with an obstetrician in the community, and we help to coordinate the services that they received in the community with the services that we offer here at VA to ensure that their care is seamless.
So it's great. So it's never a gap in the services.
Never.
It's great to hear how, how the VA has just evolved to treat women veterans. For a veteran who hasn't used the system, a woman veteran, how does she get started?
Well, she can start by dialing 1-800-463-6295, extension 7324, or she can log on to www.womenshealth.va.gov. And at that website, she can learn about the eligibility requirements, and she can enroll online, in person, or through the mail.
And we want our women veterans to know that they're veterans too. I know
Absolutely.
We've also learned in the past that sometimes women veterans don't consider themselves veterans.
That's correct. That's correct.
So I know you give more than just, or a woman can get more than just a doctor's appointment when she comes here. Tell us more about the services a woman can expect from the VA Maryland healthcare system.
Okay, well, we offer vocational rehabilitation services. There are services for homeless veterans. We have a designated PAC team that will connect with the homeless veteran to engage them and provide the healthcare services that are necessary to them. We have beds in the community, in shelters and transitional housing throughout our VA catchment so that they can have housing. And the vet center, we work very closely with the vet centers, and the vet centers provide a broad range of counseling, outreach, and referral services to combat veterans and their families.
So it sounds like the VA is a resource.
Absolutely.
It's an absolute resource for women veterans. Yes. We're going to turn our attention to Anita. Anita, thank you again for joining us.
You're welcome.
An Army veteran. So what brought you to the VA Maryland healthcare system?
So when I got out of the military in year 2000, I was told about the VA Medical Center, in particular the women's clinic. So immediately I joined a women's clinic.
And how has the VA Maryland healthcare system helped you since then? It's been quite some time.
Well, in 2012, I found out that I was pregnant, expecting my first child, and when I told the VA Medical Center, they immediately connected me to resources to help me with my pregnancy.
Yeah, because Zelda tell us they don't deliver, but they connect you with those resources. And how did that work for you? How did that help you get through pregnancy?
It helped me in so many ways. As far as they told me about different classes that I could take, and as far as my care was wonderful, the doctors that they assigned to me. Another thing that I would like to highlight that made me feel particularly special is when I had my child, the VA Medical Health Center, they gave us a baby shower. And that was so out of the box, and I just didn't know to expect that. But it was a wonderful thing. We came here to the VA Health Center, Zelda and her team, they had prizes, they fed us, we was able to bring our family, and that just made me just felt like they just went above and beyond what they're expected to do, and that made me feel particularly special.
And it's great to hear that the VA understands a woman's needs, and a baby shower is something most mothers expect and love as part of that whole process of having a baby. So that's really sweet. And I want to get back to, you've been using the VA for quite some time, so you've seen the evolution of the healthcare services for women veterans. Can you tell us a little about that evolution that you've seen?
Okay, so what I've seen, the evolution of the VA Health Clinic, especially with the appointments. Back in the day when I got out in 2000, you'd have to call in and you may have to wait. These days you don't have to wait. You call the 1-800 number and you may have an appointment sometimes like the next day. So it's been a very good transition.
I need to understand that the VA Maryland healthcare system has helped you lose weight. You look awesome.
Thank you.
Tell us about the program.
So after I had my child, I talked to my doctor and I was just telling her that I was concerned about the weight that I gained during pregnancy. And immediately, like it was her own problem, she told me about the VA Telemove. I started the program, I love the program, and I've already lost 20 pounds. And I really do like the program.
And that's Telemove, right?
Yes.
No, okay. And so for those women veterans who maybe haven't, like we said, don't consider themselves veterans, they haven't decided to use the VA, what advice would you give that veteran?
Well, I would give anybody the advice of definitely do your research and pick a care plan that's good for you. But I would also tell them the perks and the good things about the VA, and of course let them make their own decision. But I would tell them that 15 years of service that I've been with the VA, that I really like the program.
Anita, thank you so much for your time today. Thank you for your service. Congratulations on the baby and the weight loss. And Zelda, thank you for everything you do for women veterans in your program.
Thank you. Thank you.
That wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-949-1003, extension 5407, or visit us on our website at maryland.va.gov. And remember, if you are a veteran or you know a veteran who is not enrolled in the VA Maryland healthcare system, please give us a call at 1-800-463-6295, extension 7324. Visit our website. You can also find us on Facebook and Twitter. We look forward to serving you. Please join us next time.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.